Chemotherapy information for patients, their families and carers. This is a film to help you and your family understand chemotherapy, its effects on your body and how you can help yourself. It will supplement the information given to you by your doctors, nurse specialist, ward nurses and other staff you may meet. You will also be given an information sheet and chemotherapy booklet giving details of your specific regime and drugs. Where will you have your treatment? Your treatment may be given as a day case in one of our day units or on one of our wards. We also run an outreach service where chemotherapy is given in community hospitals. This means you may be able to have your treatment closer to home. Research. If you are having chemotherapy as part of a clinical trial, the research team will contact you. What is chemotherapy? The word chemotherapy means treatment with drugs. The word is used mostly to mean the treatment of cancer. Sometimes the drugs used to treat cancer are called cytotoxic drugs. The word cytotoxic means poisonous or toxic to the cells of the body. Your chemotherapy treatment will depend on the type of cancer you have. Different drugs work best on different cancers. Sometimes only one drug is required. Often more than one drug is used to make the treatment more effective. It may be repeated with a rest between each treatment. Sometimes chemotherapy is used with surgery or radiotherapy to treat certain types of cancer. Pharmacy. Your chemotherapy is prepared individually for you in a special area of pharmacy using sterile isolators. The pharmacy team have to follow very strict guidelines. This might be why sometimes delays occur. How does chemotherapy work? The drug will be given as tablets or injected into a vein or under the skin so that it can enter your bloodstream. The drug is carried around your body in the bloodstream to reach the cancer cells. The drug gets into the cancer cells and may damage their genetic material or DNA. This may prevent the cancer cells from growing and dividing in an uncontrolled way. Cytotoxic drugs damage healthy cells as well, but the healthy cells are much more able to recover than the cancer cells. When healthy cells are affected, you may get temporary side effects. Usually, your chemotherapy is followed by a rest period. This is referred to as a cycle of chemotherapy. The rest period is most often longer than the chemotherapy period. This rest or break is important, as it gives your body's healthy cells time to recover from the unwanted effects of the treatment. This plan or regime of chemotherapy varies from cancer to cancer. Cycles of chemotherapy can be as short as a week or as long as 6 weeks. Your doctor and chemotherapy nurse will explain the details to you. How is chemotherapy given? The way chemotherapy is given will depend on the drug and course of treatment you need. An intravenous injection or drip is the most common way of giving chemotherapy. These intravenous injections may be given over a few minutes or several hours. The type of drugs will depend on your particular cancer and which drugs will be most effective for you. You may be given tablets or capsules as part or all of your treatment. The nurse will explain the medicines to you and suggest when to take them. Will it hurt? One of our biggest concerns is not to hurt you. We have a specialist chemotherapy nursing service running the unit who are experienced and highly trained cancer nurses. Your cancer nurses have great experience and expertise in putting in patients' needles. This is called cannulating. We always use the smallest possible size needle or cannula. Most of these cannulas are put in the veins on the back of your hand or the lower part of your forearm. Some patients, due to the nature of their treatment, will require Hickman lines or PICC lines. If this is required for your regime, your doctor and nurse will discuss this with you. Cannulation. How can I help myself? You may have noticed that when you are hot, for example in the summer or after a hot bath, the veins in your hands are very big and prominent. Also, when you are cold, your hands and nails look pale and your veins have disappeared. This is your body's normal way of maintaining its inner temperature. You can use this natural reaction to your advantage. When your veins are prominent, they will be easier to cannulate. Therefore, on your way to the unit and while waiting for your chemotherapy appointment, try to keep yourself warm. It will also help to drink plenty of fluids so that you are well hydrated. If despite these measures your veins are still small, we may warm your hands using a bowl of hot water or a hot pack. Side effects of chemotherapy. Some people have very few side effects after their chemotherapy. If you do have side effects, they are usually only temporary and will go when the treatment has stopped. What side effects may I have? Reduced blood cell numbers. Chemotherapy often affects the bone marrow. This is where your body produces your blood cells, red cells, white cells and platelets. The white cells in your body are important as they help you fight infection. They are also short-lived, and so they will be quickly reduced by chemotherapy. About a week after your chemotherapy, the number of white cells circulating in your bloodstream will be reduced, and this will persist for several days. This means that your body is much less resistant to infections, so a minor infection can quickly become very serious and if left untreated can be life-threatening. It is important that you call the hospital or your GP immediately if you have a sore throat, your temperature is raised above 38 degrees Celsius, if you notice any unusual bleeding, bruises, or you have small groups of red, purple spots or a rash. You will be given an alert card with contact telephone numbers. Usually the number of white cells will return to normal within 3 weeks of the chemotherapy treatment. The other cells in the blood may gradually decline in number with repeated treatments, and if you become anemic, then you may be offered a blood transfusion. Nausea and vomiting. Our aim is to control nausea and to prevent vomiting as far as possible following your chemotherapy. With many drugs, you will be given anti-sickness injections. You will also be given anti-sickness tablets to take home. You will be advised on how and when to take these by the chemotherapy nurse. There are also steps you can take yourself to minimise symptoms. Eat less but more often. Feelings of hunger can be mistaken for feelings of sickness. Avoid eating fatty or fried foods. Avoid food with a strong smell or the smell of food cooking. Drink plenty of fluid, slowly, taking small sips. Ginger tablets or capsules or ginger biscuits can also be helpful. Don't lie down flat just before or after eating. Try to relax, perhaps to music or in the fresh air. You may find C-bands, the wristbands for seasickness, useful. They are available from chemists. If you are still feeling or being sick despite trying this advice and taking anti-sickness tablets, contact your GP or the hospital. Diarrhea. Some chemotherapy drugs may cause diarrhea, which usually settles within a couple of days. If you have diarrhea, try to drink plenty of water or other drinks to replace the lost fluid. If you have been prescribed anti-diarrhea tablets, take these as prescribed. If symptoms persist for more than 24 hours, contact your GP or the hospital. Constipation. Some chemotherapy and anti-sickness drugs may cause constipation. To prevent this, try eating more fibre, fresh fruit and vegetables and drink at least 2 jugs of water or similar liquids per day. If this is not adequate and you become constipated, your local pharmacist will advise you on a suitable treatment. If you require further advice, contact your GP or the hospital. Loss of appetite. You may find that you go off some food just after your chemotherapy. This may also happen if you feel sick. You may notice an odd taste in your mouth or that food tastes strange. This is because the chemotherapy has temporarily damaged your taste buds. If you have a strange taste in your mouth, you may find sucking a strongly flavoured sweet or mint can disguise this. Fresh or tinned pineapple can also help with this symptom. If your appetite is poor and you are losing weight, please ask your doctor or nurse to arrange for you to see a dietitian. Painful burning red skin following intravenous chemotherapy. Chemotherapy drugs will be injected into your vein very carefully. Some chemotherapy drugs are very damaging if they leak into the tissues. Sore mouth. You may find that your chemotherapy gives you a sore mouth. It helps if you try and keep your mouth moist and clean. Clean your mouth and gently brush your teeth with a soft toothbrush. You may be given a mouthwash solution to prevent potential mouth ulcers. Please take this medication as directed and use it regularly. If you notice small white ulcers around your lips or in your mouth or throat, you may have thrush. This is a common infection of the mouth when people are on treatment or run down. Please contact your GP who can examine your mouth and prescribe some medicine or mouthwash. Hair loss. Many patients associate the word chemotherapy with hair loss. It is often their biggest fear. However, many of the chemotherapy drugs that we use will not cause serious hair loss for most patients. More often, they experience a little hair thinning. You may also lose some of your eyelashes, eyebrows, and body hair. Some useful advice to help prevent you from damaging your hair is: avoid using hairdryers and other heated styling tools. Avoid hairspray, dye, and perms. Cut down on the number of times you wash your hair each week. Use a gentle shampoo and a conditioner, for example, one designed for babies. Brush and comb your hair gently using a soft hairbrush or wide-tooth comb. If you lose your hair, you may prefer to wear a hat, headscarf, turban or wig. If you would like a wig or turban, the chemotherapy staff can help arrange this. If you do experience hair loss, it will happen about 2 weeks after your chemotherapy starts. The hair loss is temporary and will grow back completely after treatment is finished. Scalp cooling.
Hi, I'm Denise. I'm going to put your scalp cooling treatment on for you today. Right, I'm just going to lift your hair.
This is where a cold cap is placed on the head during treatment to help prevent hair loss. The coldness of the cap cools the cells in the hair root and restricts the blood flow to them.
There you go.
This causes the cell's metabolism to slow down for a short while. They are then less affected by the circulating chemotherapy. This is not suitable for all types of chemotherapy treatment. Scalp cooling significantly increases the length of time your treatment takes, but it can be effective. Fatigue. Everyone has good days and bad days, but due to disease and cancer treatments, nearly everyone will experience some fatigue. Fatigue can mean more than being tired and weak. Other symptoms include leg pains, difficulty walking and climbing stairs, shortness of breath, difficulty concentrating and making decisions. This can sometimes continue for weeks or months after treatment is completed, making you feel irritable and low. There are many ways of combating fatigue and many strategies that can help you to manage your everyday activities. For example, keeping a diary to monitor when you are most tired and when you have most energy. Spreading tasks out over the week. Whenever possible, sitting down to do chores. Asking others to cook and shop for you or use pre-cooked meals. Regular light exercise. Drinking plenty of fluids. Using distraction techniques such as reading, visiting friends, listening to music. Knowing when you have done enough. Your feelings. The very fact that you are having chemotherapy treatment for cancer is very daunting. All at once, your whole life has been turned upside down. Future plans often have to be put on hold, and you may feel that your life revolves around the hospital. We do understand this and will try to support you in whatever way we can. Sexual relationships. Chemotherapy and the disease itself can affect sexual relationships. Some people may be unaffected by treatment, whilst others have changes in levels of desire, changes in tolerance for physical activity, and levels of fatigue. Anxiety and stress can also have an effect on sexual relationships. It is important not to pass on any bodily fluids to your partner which may contain traces of chemotherapy. Therefore, it is important to use a barrier contraceptive such as condoms for the first few days after each chemotherapy. It is also important not to become pregnant or father a child during your chemotherapy or for some time after. If you would like more information on these issues, please discuss this with your doctor or nurse. Fertility. Unfortunately, some chemotherapy treatments, though not all, cause infertility. This effect may be temporary or permanent, depending on the particular treatment you are having. Your doctor will discuss this risk with you before your treatment starts. Emergencies or problems. Call the hospital if you have a temperature of 38 degrees Celsius or more, a sore throat, shivering episodes, flu-like symptoms, you have nosebleeds, bleeding gums, bad bruising, black tarry stools, or any signs of unexpected bleeding, vomiting which is not relieved by your anti-sickness medication, watery diarrhea which has lasted more than 24 hours, mouth ulcers that stop you eating or drinking, chest pain or difficulty breathing, your skin is painful, red or blistered near where the drug was injected, your palms or soles become very sore and cracked. You will be given an alert card by your nurse. It contains a useful reminder of when to call the hospital and contact numbers. Who can I talk to for advice? You can contact one of the chemotherapy specialist nurses or the cancer nurse specialist who helps with your type of illness. They will have given you a contact number at the beginning of your treatment.
Can I take your name, please?
The Mustard Tree Macmillan Centre. The centre is open to anyone affected by cancer, including patients, relatives and carers. People can use the centre at any period in their illness. It can be found on level 3 at Derriford Hospital. Additionally, if you have a clinic appointment or are waiting for treatment, you can wait in the Mustard Tree Macmillan Centre. You'll be made to feel very welcome and offered refreshments. Just let the clinic or chemotherapy receptionist know where you are. There is also an information centre on site. Pastoral and spiritual care. A chaplain is available 24 hours a day, contactable via switchboard, and is here for absolutely everyone. They are here to offer a listening ear, help people make sense of their situation, and only if desired can provide faith support from all major religions.
And they've just been telling me a bit about some of the...
Other matters. Tablets and capsules. Keep your tablets or capsules in the bottle or blister pack that they come in. Store them in a dark, cool, dry place out of the reach of children. Let your doctor know if you are taking any prescribed medicines, as well as any you have bought from the pharmacy or health food shop. Can I drink alcohol? You may be able to drink small amounts of alcohol a few days after having chemotherapy, but you should check this with your doctor first. Alcohol is dehydrating, and you should make up for this by drinking more water or soft drinks as well. Can I go on holiday? If you have planned to go on holiday when a treatment is due, please discuss this with your doctor. Your hospital doctor may delay a treatment until you return. Many patients having chemotherapy will be more at risk from sunburn. To avoid this, use a high factor sunscreen or cover up your skin.